The learning objectives of this module are to know the indications and contraindications for bubble CPAP and to learn how to set up bubble CPAP on an infant in the delivery suite or neonatal intensive care unit. Bubble continuous positive airway pressure, or bubble CPAP, is a non-invasive method to support spontaneous breathing in a baby, which does not require a ventilator. With bubble CPAP, pressure is generated in the breathing circuit by immersing the distal end of the expiratory portion of the circuit under a water seal. This prevents alveolar collapse, increases functional residual capacity, and reduces the work of breathing. Indications for bubble CPAP may include preterm infants with respiratory distress syndrome or those who have frequent apnea and bradycardia of prematurity, transient tachypnea of the newborn, and infants who have weaned off mechanical ventilation. Contraindications to bubble CPAP may include infants with choanal atresia, congenital diaphragmatic hernia, or depressed infants with frank apnea secondary to maternal anesthesia. A relative contraindication would include an infant with significant apnea of prematurity who requires a higher degree of support, such as nasal intermittent positive pressure ventilation. The following section outlines the equipment currently being used at one of our NICUs to set up bubble CPAP in a patient. You should follow your own institution's guidelines. You will need the following pieces of equipment: an infant nasal CPAP cannula kit. This contains nasal cannulae with connectors and adapters, a CPAP knitted head cap, and Velcro, which is used to make attachment circles, as well as a moustache for the upper lip. The weight of your patient will determine the initial cannula size used. In situations where the smallest Hudson prong size is too large for the nares or blanching occurs, we use a smaller sized Inca prong. Extra thin duoderm is cut to the appropriate size. Avoid using bonding agents such as tincture of benzoin, as this can increase epidermal stripping in preterm infants. Half-inch latex-free waterproof adhesive tape, a pair of scissors, 2 size 16 rubber bands, 4 size 2 safety pins. A chin strap may be required to minimize air leak from the mouth. Also, an orogastric tube is necessary to prevent gastric distension and can also be used for enteral feeding once the infant is stable. Now we are ready to set up bubble CPAP on our mannequin.
So we match up the size of the baby with the size of the prongs, and this is the graph that comes in the prong setup. So we've determined this baby is going to be a size 1. So we just open it up and we take the parts out and take the hat and the other pieces. And first thing I do is I apply the Velcro to the prongs, and we use the 1/2 inch pink tape. The pink tape right at the end of the barrel here, as flat as possible. Do the same on the other side. This just makes the Velcro stick better with the pink tape. Try to get it as flat as you can. Then we cut the smooth side of the Velcro, not the looped side, the smooth side. And then we cut like a 1/2 inch strip for each side. And then we apply. Typically I like the seam at the top that runs parallel with the prongs, you'll see. And then we put it on and wrap it around. Nice and tight. Same on the other side, in the same position. again lined up with the prongs. And then we take the scissors and we just trim off the excess. Okay, nice and neat. Just move this stuff. And then we place these on the ends where they fit. They only fit one way. And then the little red cap. And those are ready to go. So the next thing we work on is the hat. I typically like to fold over. The hats usually fit the babies with the appropriate prongs. So we try to make, you know, probably a half or a third of the hat rolled over. And we take the 4 number 2 safety pins and we'll run them with our finger underneath, typically up a ½ inch from the edge, and try to grab as much as you can and do the opposite side. And the opened end of the pin should be away from the baby's face. And these usually about the width of the tubing, which you'll see later on. It's usually about a 3/8 to a ½ inch spacing between each. And they run parallel to each other. Okay, can you see that? And then we take the number 16 rubber bands and just run a, and I usually put a double knot in there just to make it a little tighter. Okay. And the next thing is we want to make the mustache. Typically like the mustache about mid-cheek, or probably lines up with the outside of each eye. And you want to be probably about 2/3 of this width between the edge of the nose here and the upper lip. So I usually start with the looped side. It's the other one besides the opposite of that one. It's on the barrel of the prongs. Typically cut. And I usually cut about half the width of this, right down the middle. And you can see it's typically from here to here, approximately. But you can see it's a little too wide. So how I start out is I'll actually round it off on one end and the other end. And then kind of go in to where the nose would be. So we want that pretty narrow. See, it's going to fit just like that. If we were to stick this right on the baby like this, it wouldn't stay long. So we have to put a sub base of Duoderm extra thin. So how we do that is I take a piece of that and I'll take the sticky liner off and stick it on here, and then I'll trim it all the way around. There's different versions, but this is what I do, and I find it easier. You can see trim, maybe leave a 1/16 of an inch all the way around. Sometimes I run a little extra tab on the bottom. Make sure you be out on each cheek side. And about a 1/16 of an inch all the way around. And there you go. Let me turn that up a little bit. Alright? And we peel the back of the duoderm off. And we basically center it. And try to keep it away from the upper part of the nose. And we apply it all the way down. Oop. And then we're going to fit the hat on. But I also have to put I find it easy to put the rubber bands on first before I put it on the baby. So you just loop it around the bottom.
Yeah.
So that's sort of how it looks. Okay? So then we place the hat on. And you want to center it on the head, and then the prongs will go in. Hook the ends of the CPAP setup from the humidifier. One's an insertory line and one's an expiratory line. And then we just place the prongs in. The prongs should be firm fit. If you have any blanching, then the size you have is too big. You have to go down one size. These actually look pretty appropriate. Okay, I'm just going to show you how we put the rubber band on. So basically it just goes over the bottom one, around and around. So it's basically that. Alright, and we're going to do the other one same way. Alright, and then the prongs go back on. And again, we talked about being too tight, you'd see blanching around the ears, and it's definitely too small. And then basically Velcro should lick, these two pieces of Velcro being the matching part should hold it down on the upper lip, the prongs. And then we just take this, the other end of the rubber band, and we flip it over. Sorry. Oh my God. It's supposed to be easy. Alright, and you can probably see it better on this side. Basically just kind of an X, and it loops around each side of the pin. Get a better picture of it. There you go. Same with the bottom, see? Oops. And that's basically the setup. You don't want the prongs buried onto the nares. You want a little bit of an airspace. We call it a cushion. They're also available NICU, which kind of a little foam piece that fits in between the prongs and the nose. So that's basically it. We also put on this, take this off, and we put it on a monitor, so we monitor the pressure in centimeters of water pressure. Typically the range is anywhere from 5 all the way to 7.
The following section outlines the equipment currently being used at one of our NICUs to set up the remainder of the bubble CPAP apparatus. You will need the following pieces of equipment: CPAP chamber, CPAP chamber cover, corrugated tubing hose. One end is attached to the expiratory limb of the breathing circuit with its terminal end immersed under water seal in the CPAP chamber to create positive pressure. As you can see, lowering the level of the tubing into the CPAP chamber will result in a higher amount of positive pressure delivered. Water column chamber, sterile water bottle, 0.25% acetic acid, analyzer connector, analyzer, flow meter attachment tubing, breathing circuit with corrugated tubing with inspiratory limb and expiratory limb, oxygen blender, heated humidifier chamber. Now we will demonstrate setting up the bubble CPAP circuit with the humidifier.
First thing we put in is the water chamber. Just clips in there to make sure the label's out front. Next step is put in the water column chamber. Just slides in like that. And I'm going to just undo the caps here and just bottom one gets plugged into them. Pierce the water container. Same with the top. Just push and turn. Make sure your clamps are not clamped. Next step is, doesn't matter which one, you place it in here and then you hook it to one of the flow meters. Push and wiggle. And then we have to have, you put in the analyzer connection, same thing, push and pull. And this is your analyzer. You place the probe in to the opening. There's only one opening, it only fits one way, so just like that. Okay. Next thing is to fill the water, CPAP water chamber up to the 0 on the label with acetic acid of 0.25%. There we go. And then we put our hose in up to the level of CPAP we want. In this setting it's going to be on 5 centimeters. Then we put the little locking cap on. And then we slide over here and put it in a little holder. And so we take the breathing circuit and we take the inspiratory limb and put it on the humidifier outlet. Then we take the expiratory side of the CPAP circuit and we put it on the expiratory side to the CPAP canister. So we take the patient Y off, and these are the 2 ends that we actually attach to the CPAP prongs. It's the inspiratory side and it's the expiratory side. We put both ends in here. We're going to lift the rubber band up, slip through, connect it to the connector, and do the same on the other side. Doesn't matter which side goes on that, it's just a continuous flow through. And that's it.